Hello, Senator Ted Budd. My name is Desiree Barnes, and I am a registered nurse in the great state of North Carolina. I am meeting with you today to advocate for the passing of Senate Bill 1113. As a member on the Committee of Health, Education, Labor, and Pensions, I am sure you're already aware of this bill, but I just wanted to take a moment to summarize its contents and why it's important to myself, my nursing colleagues, and the American Nurses Association. As an amendment to the Public Health Service Act, Senate Bill 1113, also known as the Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act of 2023, seeks to establish safe staffing ratio requirements for direct care registered nurses in hospitals. This bill, which was sponsored by Sherrod Brown of Ohio, along with 9 co-sponsors, was introduced and read twice before the Senate on March 30th, 2023, and then referred to the Committee on Health, Education, Labor, and Pensions. An identical bill was also introduced to the House of Representatives on April 6th of 2023. This bill seeks to require hospitals to implement a staffing plan with specified nurse-to-patient ratios to the Department of Health and Human Services, and to follow certain procedures in the determination of these ratios. Further, the bill would prohibit non-nursing staff from performing nursing functions unless they were specifically authorized by their state's scope of practice laws. Additional stipulations of the bill include adjusted Medicare payments to cover any additional costs related to compliance, the right for nurses to refuse unsafe assignments that violate appropriate staffing ratios, the right for nurses to refuse assignments for which they lack appropriate experience or training to safely care for the assigned patients, the inability for hospitals to take adverse action against nurses for reasonably refusing unsafe assignments, and the right for the Department of Health and Human Services to impose monetary penalties against hospitals that violate these ratio requirements. The bill also allows for stipends to bolster the nursing workforce loan repayment and the nurse retention grant programs, which we direly need in the shortage of nurses. Substantial research has demonstrated that heavy registered nurse workloads contribute to higher patient mortality as well as other adverse patient outcomes. However, as of now, California remains the only state that currently implements mandatory minimum nurse-to-patient ratios. A study by Lassiter and others showed that a 16% increase in mortality and increased length of stay occurred with each additional patient in a nurse's workload. Another study by Cho and others demonstrated that inadequate nurse staffing results in a high prevalence of missed patient care, which negatively impacts patient safety and quality outcomes. And the study further showed that inadequate staffing increased nurse job dissatisfaction and turnover. Due to the substantial evidence supporting safe nurse-to-patient staffing ratios, the International Council of Nurses issued a position statement in 2018 urging a call to action. As a result, several countries have implemented mandatory nurse-to-patient ratios that have resulted not only in better patient outcomes, but it's also reduced overall healthcare costs. I feel that there is overwhelming evidence that supports the enactment of safe staffing practice as a way to improve both patient and nursing outcomes. As such, I am asking for your support in the enactment of this legislation as a means of ensuring both safe, quality patient care and as a step towards addressing the ever-increasing burnout that is plaguing direct care nursing staff. I thank you so much for your time and consideration in this matter, and I look forward to your vote in favor of Senate Bill 1113.